5 hidden causes of persistent mucus in your throat. Have you ever found yourself constantly clearing your throat, wondering why that sticky, irritating sensation just won't go away? If so, you're not alone. Millions of people around the world silently suffer from persistent throat phlegm, often without ever identifying the real cause. While some medications work for a few, many find them completely ineffective. So what's really going on? The truth is, chronic phlegm is more than just an annoying side effect of a cold or seasonal allergy. It could be your body's way of signaling deeper health issues. Today, we'll reveal the 4 most overlooked yet critical causes of this problem. More importantly, you'll learn how to recognize and address each one effectively. 1. The real purpose of phlegm and what happens when it goes wrong. Phlegm is not your enemy. It's actually a sophisticated part of your immune defense system, created by the mucous membranes lining your respiratory tract. Its job: to trap dust, allergens, microbes, and other harmful particles before they reach your lungs. Under normal conditions, your body produces about 1 to 1.5 liters of mucus per day, most of which you swallow without even noticing. However, when production becomes excessive or its texture becomes thicker, it turns into a problem, leading to that persistent sensation of a lump or something stuck in your throat. Why this happens? Irritation, inflammation, or infection in the airways causes an uptick in mucus. Dehydration can thicken mucus, making it harder to clear. Color and consistency of mucus offer clues. Clear, often linked to allergies or irritants. Yellow or green suggests a bacterial infection. Thick and sticky, often due to chronic inflammation or dehydration. If phlegm persists for more than 2 weeks, it often signals a chronic condition that requires medical attention. 2. Silent reflux, the hidden culprit behind chronic throat mucus. You might think reflux only causes heartburn, but silent gastroesophageal reflux, LPR, is one of the most underdiagnosed causes of chronic throat phlegm. In silent reflux, stomach acid rises up the esophagus and reaches the throat without the classic burning sensation. When acidic contents touch the sensitive lining of your throat, vocal cords, or sinuses, your body produces extra mucus to defend the tissue, leading to that constant throat-clearing reflex. Symptoms of silent reflux: laryngopharyngeal reflux, morning hoarseness, dry cough that won't go away, metallic taste in the mouth, a sensation of something stuck in your throat, bad breath that persists despite good hygiene. Why it worsens with age. After age 50, the lower esophageal sphincter weakens and stomach acid production declines, paradoxically increasing reflux risk. Weaker closure allows even small amounts of acid to travel upward. Studies confirm that LPR is a leading cause of chronic throat symptoms, including mucus overproduction, Kaufman J.A., ear, nose, throat J. 2000. What you can do: avoid trigger foods, coffee, alcohol, chocolate, citrus, spicy meals. Eat smaller meals more frequently. Don't lie down within 3 hours of eating. Elevate your bed head by 6 inches. Consider seeing a gastroenterologist if symptoms persist. 3. Chronic sinusitis, the post-nasal drip that won't quit. Your sinuses, air-filled spaces near your eyes and nose, are designed to stay moist and clean through the constant movement of mucus. But when the sinuses become inflamed due to infection, allergy, or structural issues, mucus can become trapped and drip down the back of your throat, post-nasal drip. This leads to that nagging phlegm sensation, often worse when lying down or first waking up. Common causes of chronic sinusitis: long-standing or untreated bacterial infections, nasal polyps blocking sinus drainage, deviated nasal septum, chronic allergic rhinitis. Symptoms include nasal congestion that never clears, loss of smell or taste, persistent bad breath, facial pain or pressure, worse when leaning forward, nighttime coughing or frequent throat clearing, fatigue from chronic inflammation. CT scans of the paranasal sinuses are often used to confirm chronic sinusitis. A study in the laryngoscope, 2012, showed that postnasal drip is a major factor in chronic throat clearing among sinusitis patients. Relief strategies: daily saline nasal rinses, 1 teaspoon sea salt in warm water, steam inhalation with eucalyptus or menthol oils. Hydration: drink plenty of fluids to thin mucus. Treat underlying allergies or infections. Seek ENT evaluation for nasal blockage or structural problems. 4. Allergies. The invisible enemy suffocating you from within. One of the most overlooked causes of chronic phlegm is respiratory allergies, an invisible but powerful disruptor that can persist for months or even years. Your immune system, designed to defend your body from real threats, sometimes mistakenly attacks harmless environmental particles such as pollen, dust mites, mold spores, pet dander, or even certain foods. When this happens, your immune system releases histamine, a chemical that causes inflammation of the mucous membranes, particularly in the nose, sinuses, and throat. This inflammation triggers overproduction of mucus as a protective response. What follows is a chronic inflammatory cycle that continues long after initial exposure, especially when the allergens remain in your environment. How to identify allergy-induced mucus. Consistency. Usually clear and sticky, not thick or discolored like in infections. Accompanying symptoms. Itchy eyes, sneezing, nasal congestion, or post-nasal drip. Seasonal fluctuations. Worsening in spring or fall may point to pollen allergy. Year-round symptoms, worse indoors, may suggest dust mites or mold. Symptoms triggered by contact with animals hint at pet dander or saliva allergies. Food allergies. Some people react to dairy, eggs, wheat, or shellfish with increased mucus, particularly in the throat and sinuses. Dairy, especially, can worsen phlegm in those with lactose intolerance or casein sensitivity. What you can do. Allergy testing. Skin prick tests or IgE blood tests can accurately identify triggers. Environmental control. Keep windows closed during high pollen seasons. Use HEPA-filtered air purifiers in your bedroom and living areas. Wash sheets weekly in hot water, above 60 degrees Celsius per 140 degrees Fahrenheit. Vacuum frequently using HEPA-equipped cleaners. Remove carpets, heavy curtains, and stuffed toys if possible. Indoor humidity. Maintain between 40 to 50% to reduce mold and dust mite growth. A study published in the Journal of Allergy and Clinical Immunology, 2012, confirmed that allergic rhinitis significantly contributes to chronic throat clearing and mucus buildup, particularly in patients with seasonal or perennial allergen exposure. 5. Infections. When your body is sounding the alarm. Among the most serious and direct causes of excessive phlegm are respiratory infections, caused by viruses, bacteria, or less commonly fungi. When pathogens invade your upper or lower respiratory tract, your immune system reacts aggressively to neutralize them. This response involves inflammation, increased blood flow, and the release of immune cells, all of which trigger massive mucus production to trap and expel these invaders. Key characteristics of infection-related mucus. Viral infections, e.g. colds, flu. Mucus is usually clear or white, accompanied by symptoms like low-grade fever, body aches, sore throat, and fatigue. Typically lasts 5 to 7 days and resolves without antibiotics. Bacterial infections, e.g. sinusitis, bronchitis, pneumonia. Mucus often becomes yellow, green, or foul-smelling. Symptoms persist beyond 10 days, may include high fever and worsening cough. Fungal infections, rare but serious in immunocompromised individuals, often produce thick mucus with possible bleeding. Warning signs that demand urgent medical attention. Blood and mucus, even in small amounts. Fever over 38.5 degrees Celsius, 101.3 degrees Fahrenheit, that doesn't respond to medications. Chest pain when coughing or breathing. Shortness of breath, even at rest. Fatigue, loss of appetite, or night sweats. The New England Journal of Medicine, 2019, reports that persistent bacterial infections of the lower respiratory tract, such as bronchitis or pneumonia, are among the most common causes of chronic mucus production in adults over 50, particularly those with compromised immunity or chronic conditions. Treatment approach. Viral infections. Rest, hydration, saline rinses, and steam inhalation are often enough. Bacterial infections. Require proper medical evaluation and targeted antibiotics, but only when clearly needed. Avoid self-medicating with antibiotics, which can lead to resistance and worsen future infections. 6. Know when to seek help. Life-saving red flags you shouldn't ignore. Sometimes persistent phlegm isn't just a sign of allergy or infection. It may be pointing to something more dangerous like a chronic lung condition, autoimmune disease, or even cancer. That's why it's critical to know when chronic mucus has moved beyond normal. Urgent warning signs: coughing up blood, even small streaks. Fever above 39 degrees Celsius, 102.2 degrees Fahrenheit, that lasts more than 2 days. Severe chest pain, especially when coughing or inhaling. Persistent hoarseness for more than 2 weeks. Unexplained weight loss. Enlarged lymph nodes in the neck lasting longer than 2 weeks. Extreme night sweats soaking your clothing or sheets. Loss of appetite with nausea or difficulty swallowing. Who's at higher risk? Adults over 60 years old. Smokers, or those with a long history of smoking. People with chronic illnesses like diabetes, heart disease, or COPD. Those with compromised immune systems. If you notice these signs, don't wait. Early intervention could be life-saving. Consult an ENT, pulmonologist, or allergist depending on your symptoms. According to the British Medical Journal, BMJ 2021, chronic cough with phlegm lasting more than 8 weeks, especially in older adults, can be an early indicator of chronic bronchitis, GERD, or laryngeal cancer, and must be thoroughly investigated. 5 natural remedies that can eliminate phlegm in just days. Nature offers powerful, time-tested remedies that can significantly reduce persistent mucus and restore respiratory comfort. These natural solutions are not only supported by traditional wisdom, but also increasingly backed by scientific research. 1. Proper hydration, the first and most crucial step. Adequate hydration is the foundation of any mucus-clearing strategy. Drinking at least 2 liters of water per day helps thin out thick mucus, making it easier for your body to expel. When you're dehydrated, mucus becomes sticky and thick, which not only clogs your airways, but also provides an ideal environment for bacterial growth. A study published in Chest Journal, 2014, confirms that proper hydration enhances mucociliary clearance, the process your lungs use to remove mucus and debris. Warm water is even more beneficial as it soothes irritated mucous membranes. Add a pinch of sea salt to warm water for a natural isotonic solution that hydrates and gently flushes sinuses. 2. Thyme tea, nature's powerful mucolytic. Thyme is a medicinal herb with proven mucolytic, mucus-dissolving, and antimicrobial properties, thanks to its key compounds thymol and carvacrol. It helps break down thick mucus while simultaneously fighting underlying infections. Boil 1 tablespoon of dried thyme in 250 milliliters of water. Steep for 10 minutes, strain, and drink 3 times a day. Inhale the herbal steam to double the effect, especially for sinus congestion. A 2015 review in Evidence-Based Complementary and Alternative Medicine supports thyme's efficacy in respiratory tract infections and mucus breakdown. 3. Fresh ginger with honey and lemon, anti-inflammatory powerhouse. Ginger contains gingerol, a potent anti-inflammatory compound that reduces swelling in the mucous membranes, making it easier to cough up or drain mucus. Slice a 2-inch piece of fresh ginger, boil in water for 15 minutes, then add pure honey, a natural antibacterial agent, and fresh lemon juice, rich in vitamin C. Drink this remedy 2 to 3 times a day for optimal results. Research published in the Journal of Ethnopharmacology, 2013, found that gingerol reduces airway inflammation and improves bronchial function. 4. Raw garlic, nature's antibacterial shield. Garlic contains allicin, a sulfur compound with strong antibacterial, antiviral, and immune-boosting effects. Chop 2 cloves of raw garlic and let them sit for 10 minutes to activate allicin. Swallow with water or mix with honey to make it easier to ingest. A study in Clinical Nutrition, 2009, demonstrated that garlic supplementation reduces the frequency and duration of upper respiratory infections. 5. Humidification and steam inhalation, moisture for mucus relief. Dry air irritates the respiratory tract and worsens mucus production. Keeping indoor air humid, between 40% to 60%, helps your mucous membranes stay hydrated and functional. Practical methods. Use humidifiers in your bedroom or living area. Place bowls of hot water with a few drops of eucalyptus oil to add moisture and natural decongestion. For acute relief, do steam inhalation. Boil water, place your face over the steam, covered with a towel, and breathe deeply for 10 minutes. Repeat 2 to 3 times daily. Studies in the Journal of Aerosol Medicine show that steam inhalation significantly enhances nasal airflow and mucus clearance. Daily prevention habits. The secrets no one taught you. Prevention is always better than cure. And for persistent phlegm, small daily habits can make a world of difference. These overlooked strategies can drastically reduce mucus buildup and keep your airways clear. 1. Avoid cold, dry air from air conditioning. Artificial air systems often blow cold, dry air, which dehydrates mucous membranes and leads to compensatory overproduction of mucus. Favor natural ventilation. When AC use is necessary, use it with a humidifier or keep a bowl of water nearby to maintain ambient moisture. 2. Eliminate mucus-producing foods. Some foods stimulate excess mucus production, particularly in sensitive individuals. Main culprits: dairy products, especially milk, commonly linked to thicker mucus in the throat. Refined sugars and processed foods promote inflammation and mucus buildup. Recommended alternatives: eat leafy greens, berries, and citrus fruits outside of active infections. Choose anti-inflammatory foods like turmeric, garlic, and green tea. A 2018 study in Nutrients Journal highlighted that high sugar and processed food intake increases systemic inflammation, contributing to chronic respiratory symptoms. 3. Gentle physical activity. Moderate, consistent exercise boosts circulation and enhances mucus drainage from the lungs. Aim for 30 minutes of walking daily. Avoid intense activity during flare-ups, as it may worsen inflammation. Frontiers in Physiology, 2020, shows that light exercise improves lung function and mucus clearance, especially in sedentary individuals. 4. Elevate your head during sleep. Sleeping flat can cause mucus to pool in the throat, worsening nighttime congestion and coughing. Sleep with your head slightly raised using 2 pillows or a 6-inch mattress wedge. This also helps prevent acid reflux, a hidden contributor to chronic throat mucus. 5. Practice deep breathing exercises. Structured breathing supports stronger respiratory muscles and clears stagnant mucus. Technique: inhale deeply through your nose for 4 seconds. Hold your breath for 4 seconds. Exhale slowly through your mouth for 8 seconds. Repeat 10 times, 3 times a day. Respiratory Care Journal, 2016, found that diaphragmatic breathing improves ventilation and mucus movement, especially in patients with chronic bronchitis. 6. Maintain a clean, allergen-free environment. Dust, mold, and pet dander are common triggers of mucus overproduction. Habits: vacuum carpets and curtains weekly using a HEPA filter vacuum. Use natural cleaning products to avoid chemical irritants. Change HVAC filters monthly to maintain air quality. Now that you understand the natural solutions and daily practices that address the root causes of persistent mucus, you're equipped to take back control of your respiratory health. Millions suffer silently, relying on temporary fixes. But you now have powerful tools backed by both tradition and science. Don't let phlegm diminish your quality of life. Start implementing these remedies and preventive measures today, and feel the difference within days. Your body is designed to heal when given the right environment. If you found this information helpful, like, subscribe, and turn on notifications to stay updated with more natural health tips. Share your experience in the comments. What remedy has worked for you? Or which one are you trying first? And don't forget to share this guide with loved ones, because a life of clear breathing and natural vitality is within reach, one simple change at a time. Thanks for watching, and I'll see you in the next video.